everyone. Thank you for joining our YouTube live today exclusively for AIA BHD. My name is Vivian and today we have Dr. Arfian Ibrahim, our resident pulmonologist and physician, to talk about lung cancer. Before we start, allow me to share with you a little of Dr. Arfian's background. Dr. Arfian obtained his medical degree from University of Wales, UK in 2000, following his specialization in internal medicine from Royal College of Physicians, UK. He went on to subspecialize in respiratory medicine at Queen Elizabeth Hospital, Sabah. He has worked with both in UK and Australia and as the head of medicine in Tawau General Hospital prior to joining Gleneagles. Dr. Arfian is trained in addition to a wide variety of general respiratory problems, sleep medicine, interventional pulmonology, and non-invasive ventilation for respiratory failure. He has an interest in acute medicine and special interest in interstitial lung disease and obstructive airway disease. Being a Sabahan, Dr. Arfian hopes to advance the field of respiratory in Sabah. If you have any question for Dr. Arfian, please send us your question in the comment section, or you can WhatsApp me and Dr. Arfian will try to answer your question towards the end of our session. Without further ado, I will pass this session to Dr. Arfian. Hi, Doctor.
Oh, hi, Vivian. Hi. Very good morning to everyone. Welcome to the talk. So my talk is basically about lung cancer, and we're going to look at, are your lungs healthy? So as you know, I'm working at Gleneagles Hospital here, and I'm the resident pulmonologist. Just a little quick function of the lungs. So in a normal person, we have 3 lobes on the right side and 2 lobes on the left. So your air enters through your trachea here, goes all the way down into your lung, and then it divides into 2, which is right and left, and then your small bronchioles and develop. The pleura is the term that we use to describe the lining of your lungs. And if we look further into your lungs, it's basically, it branches out almost like a tree. Now these scopes, the conventional scopes that we have, we normally can go up to 8 generations of your divisions of the lung. But now there are super thin scopes, we call them, that can go all the way up to 12 to 16 generations. So having to navigate through this takes a lot of skill. It's not easy. I'm just going to go through a little bit of data. So we're going to start with the Cancer Registry report, which was published for the year 2007 to 2011 data. Unfortunately, we haven't had any more publication on what happens after 2011, but we do have one, which is the Malaysian study Cancer Survival, which actually which follow up this group of patients from the first study all the way up to 2016. So the first thing about the 2011 data, as you can see here, lung makes up the number 3 causes of lung cancer in Malaysia, about 10%. And if we break it down to about 100,000 population, we're standardizing it to age. For male, lung cancer is second, 14%. For female, lung cancer is at number 4. If you look at the age as we grow older, this is for male, you can see that starting at around about the age of 45, around 50, the incidence starts to go up, and it goes up exponentially very high and very fast, until by the time around about 55 years old, it becomes the number 1 cancer in males in Malaysia. For female, it's a little bit better. Number 1 is still breast. Here you can see the top one here. So breast starts at around 25, it starts to diverge and goes up. But as you can see, for females, for lung cancer, again, it starts to diverge around about the 50 years old mark. So then it becomes peak at around to become the number 3 cancer in Malaysia for females. If we break it down to Malays, according to race, so Malays, lung is number 1 for male at about 12%. For female, it's still at number 5, yeah, about 4%, which is not too much. For Chinese, lung is number 2, and female is number 4. The percentages are almost the same. For Indians, lung is still number 2 for males, and for female, it's way down. Actually, it's not even in. So if you're Indian female, you're much better off in Malaysia in terms of lung cancer. If we look at the stages, according to stage, what are the stages of the lung cancer that was detected? So for male, stage 1 is only 4%, but if you look at it, a lot of it is in stage 4 and stage 3. Majority of it is in stage 4. For male, it's 66%. For female, it's 71%. I'll go deeper in how all these stages later meant for the patient. In Sabah, if we look at it, this is per 100,000 population. So you can see that in male is 14%, lung cancer, in female is 9%, which is not too bad, but we're still on the top peak here. So a few cancer facts about Malaysia. This is from 2015. So you can see that the government alone spends about 240 million alone on the oncology drugs. 5 most common one that we've already seen the data. One of them is lung for women and men. Second cause of death in private hospitals in 2014. 37,000 new cases in 2012 alone. How does that impact economically for the patient? This is looking at the patient. So a year after you are diagnosed with lung cancer, 11% of them will die. 45% will develop financial catastrophe. 44% will be alive with no financial catastrophe. So 1 year following diagnosis, you can see that a lot of it will be spent on your personal saving, on the medication, on the cost of treatment. And some of them have to stop treatment, around 20%, because they couldn't pay anymore for the treatment. And this is from US data. As you can see, the death from lung cancer is more than prostate, breast, and colon cancer combined altogether. So it's a very substantial disease, which actually causes a lot of death. But the worst thing is, we all know that lung cancer is most preventable form of cancer death in our society. And a lot of it, 87% of lung cancers that we see are actually smoking related. So you can see a picture here. This is a healthy lung. You can see some carbon black deposits here. These are from air pollution. And this is from a smoker's lung. So it's very black. And right here in the middle here, where you can see it's being cut out, is where the lung cancer is. Now, I've given this talk before, and I've had questions where they ask my uncle, or I know somebody who stopped smoking 10 years ago, and then 10 years later he developed lung cancer. So we've got data to explain why that happens. So you can see here, this is data from as early as 1900s. You can see that when people started smoking, there is about a 20-year lag before lung cancer picks up. So it takes about 20 years of exposure to smoking before you actually develop lung cancer. And that is why, even though if you stop 10 years ago, the effect of the smoking that you had comes out about 10 to 20 years later. So that's explain how people later on develop lung cancer despite having stopping smoking. And this is the latest, this is the survival up to 2016, the one that I was talking about. So initially they collected the data up until 2011, and then they followed this same amount of patients up to 2016 to see how much of them are still alive. So I've highlighted lung here, which is a bit low compared to the rest of the cancers, but it's still, survival is only at 35%. Okay? Compared to thyroid, where you have thyroid cancer, you're more likely to survive at 90%, whereas you have lung cancer, which is the worst, 35% and 11%. Median survival time, how long do you live once you're diagnosed with cancer? So we look at here at the median survival time here For lung cancer, 0.5 years, which is 6 years, right? Which is not much. And if you look at staging, so this is very important when we look at the staging. Here you get stage 1, stage 2, stage 3, and stage 4. You can see that at stage 1, even at stage 1 of lung cancer, the survival rate is only 37%. This is from the Malaysian data. And if you have stage 4, it's only 6% you're going to survive. So in short, smoking is the major cause of lung cancer in our society. And just a little bit about secondhand smoking. So a lot of people ask, how am I at risk if I have somebody smoking in my house or somebody who I know smoking? So if you smoke, you are in a non-smoking section of a restaurant for 2 hours, that's equivalent to 1.5 stick of cigarette, right? So if you are staying with somebody who smokes, that's equivalent to smoking 3 cigarettes a day at home. If you go to a bar, a club, or a restaurant where last time everyone was smoking and it's full of it, so it's basically equivalent to 4 cigarettes a day. Well, just to put it in perspective, secondhand smoke, it is very important because it causes 30 times as any lung cancer death combined with any air pollutions that we know. So just to put it back together in one slide, majority secondhand smoke, some diesel exhaust, certain metals if you're working in factories, and organic chemicals, radiation very, very low, air pollution again very low. Okay. There will be questions asking about e-cigarettes. Is it safe? So I've taken up studies which look at from 2016, which shows that e-cigarettes, does it actually help you stop smoking? So from this study, it shows that as currently being used, e-cigarettes are associated with significantly less quitting among smokers. And again, in February 2018, environmental research shows that e-cigarettes actually is a source of toxic and potentially carcinogenic metals. Again, in this journal, it shows it's the same thing. All the heavy metals that are in the e-cigarettes are very harmful and can cause cancer. So in conclusion, it just adds on to the existing evidence that e-cigarettes are very relevant. A lot of us will also be concerned, like now that we know that lung cancer is grim. Once you've had it, your chances of survival is very low. How do we know or suspect that we may have lung cancer? One of them is basically if you have an unexplained persistent cough of more than 2 weeks duration, or if you have gradual onset of shortness of breath or wheezing, which actually goes on, it doesn't go away, coughing up blood at any time, you have repeated lung infection, you keep having repeated lung infection, or you get chest pains that worsens with a deep breath. This is not very common, but majority of it, what we see will be on the upper part here. Now, a lot of questions also ask, why is it that there's a lot of stage 4 lung cancer that we see? If we have cough, we see them early. We should be able to pick it up early. So this is a study by Fletcher and Petro. This was done in the 1970s, which is very good because what it shows here is, if you can see the blue graph here. So at the age of 25, our lung is matured at 100% here. So we do the lung function test, which we have here in the clinic. We ask you to blow and we see how your lung function is. It matures at 25. And as we grow older, as naturally our body starts to grow a bit older, the lung function starts to decline. But it declines in somebody who's healthy up to around here, around 75%. Now, if you smoke, the lung function decline is worse, is faster. But as you can see here, what we can deduce from this graph is that you only have symptoms when you lose 50% of your lung. By the time you have lose 50% of your lung, majority of the cancer that we see are already in stage 3 or stage 4. That's when you start to feel breathless. That's when you sometimes have cough, chronic cough that doesn't go away. Sometimes you get coughing up of blood. So by the time you actually have symptoms, you've lost 50% of your lung, which is about stage 3 or stage 4. So that explains why majority of cases that we see are around stage 3 and stage 4. So just a quick percentages as well. So this study have looked at all the studies looking at lung cancer, and they pulled them up, all the symptoms. So as you can see, the percentage of patients that present with any of the symptoms is a very big range of them, from 45% to 74%. So it's not easy to actually detect lung cancer based on symptoms. So if you're worried about lung cancer and you think you may have lung cancer, well, the best advice is to see your doctor. And what we normally do is we do lung cancer screening. And we do that with a CT of your lung, we call low dose CT. So I'm going to go through some data just to show you that with CT of the lung, if we detect your lung cancer early, we're looking at 20%. We're going to reduce the mortality, your chances of dying by 20%. We diagnose 13% of new lung cancer. And this is where it shows here. So if you don't do lung cancer screening, your survival rate is only 3.5%. But if you do lung cancer screening and we detect it early, survival rate goes up to 85%. And we're just going to go through some data as well. At what age do you get when you detect lung cancer? So we're looking here, you can see the peak of it is around 50 to 70 years old. Then after 80 and below 50, the chances of picking up a lung cancer is very, very small. And just to show you on the X-ray what we see here, so here you can see there's a big mass here, growth here, or it can come up with a very small growth over here. But the problem with X-rays is that it doesn't tell us how big or how much extent it's gone into. So that's where we need a CT scan. So we do a CT scan, and this is where we see it. Here you can see there's a lung mass here. Then this is another one, where lung mass. So you can see actually with a CT scan how big it is really on the chest X-ray, where you can't actually tell. Once we've done the CT scan, which shows that you do have something suspicious, the best option, one of the options that we can provide is a bronchoscopy, which is done under sedation and it's a day case. So you don't have to stay in the hospital for overnight. So what we do is we go in, we go through that vast network of your lung, we go in with a forceps. So if we see a tumor growing there, we just put in a forceps, take a small bite, and then diagnose you. So this is how we do it. We go in through your nose, go all the way down your trachea, and then we navigate and find where that lesion is and take a biopsy. Right. Another option sometimes is when it's very far away and our scopes cannot reach. As I showed earlier, our scope can reach up to 8 or 9 generations of your lung. Then after that, further divisions, our scopes cannot go in. So when it's quite close to the edge of the lung, we can do a CT guided biopsy. So this is done by our radiologist. So basically you go in and a CT scan, and they put in a needle, go in and take some tissue biopsy. Sometimes you can develop water in the lungs, paru-paru bayi kan. So that's very easy, because then what happens is the water is here, it collapses your lung, create a space, so we can put in a small scope. And these are 2 pictures of real life patients that we've done here. Which shows here you have the cancer on the lining of the chest wall. Again, this one cancer on the lining of the chest wall. This is actually a liver cancer patient, so which the cancer has spread into the lining of the lung here. And so this is how we do it. So the patient lies on the side, and we go in from the side. It's all done under local anesthetic, so you don't need to be asleep. Some patients even, they watch the TV and see the inside of your lung at the same time. Last option, if we still cannot get anything and there is something there, is basically surgery. So this is done under general anesthetic, so you'll be very fast asleep, you won't feel anything. So this is called keyhole surgery, or VATS, video assisted thoracoscopy. So the surgeon, Dr. Abu, we'll put in about 3 or 4 holes in here, and then we'll go in with small cameras and forceps and take out a bit of your lung growth there for biopsy. Okay. So now the treatments, basically, so if we catch your lung cancer early, surgery achieves cure. There's no other way. The only way to take out, to cure cancer is basically take it out of the body. You can't leave it there. But if we catch you at a later stage, stage 3 and stage 4, then the only treatment that we have is chemotherapy. Now we're lucky with lung cancer now because we have new options which comes in injection and pills which you can actually stay at home and just take daily and just come for review in clinic. Now just a quick word about chemotherapy. Treatment is palliative, meaning it's not cure. What we're doing is just basically prolonging time. So once you've gone through that, you've diagnosed it, we've gone all the procedure, we know what you're staging. So you're either on chemotherapy or you go for surgery. There are complications that can happen. And one of them is this. So basically, once we've diagnosed you with cancer, here you can see this is normal lung. Black color is normal lung. Here you can see this part of the lung is white. So what's happened is that lung cancer has blocked off that pipe, one of the generation of the pipes of your airway, and basically the lung collapsed. So when this happens, you will feel breathlessness. Now, the moment this happens, automatically we can say this is almost certain is stage 3 already. So you can see here, that is why lung cancer always presents very late. In this patient, what happens is that there's water here. So a normal lung should go all the way down here like that. But what happens here is that this part here, which is supposed to be black, is white. So this is water. So when we see water here in the setting of lung cancer, this is automatically stage 4. So this is why patient presents very late. So one of the things that we can do when you have this blocked airway is we can try and open up the airway. So it makes your breathing better. So what we do is, we're just going to show you a video of what we do. So this is one of the stents that we do use. So we go in, because the stent, we're going to have to go in through your mouth, going into your airway where the cancer is here, over there. So the stent goes through. Okay. Yeah, so that's your cancer there on your airway. We go in with the stent, which is neatly packed into this very thin wire. So the wire goes in, it stays there. Then we put in the stent. Okay, the stent goes all the way to where your tumor is. And then we go in with a scope to make sure everything is the correct place before we release the stent. And then we release the mechanism. And there the stent opens up and opens up your airway. Then your breathing becomes better. Then you can go for further treatment. Right? So normally we check later on with the scope just to make sure everything is good. Right. One of the ways that we can do is, if we can't put in a stent, for example like this, where you don't need to put a stent, you can see it's just a very big growth here. So what we do is we do microsurgery inside your airway, again through your mouth. We go in and we just laser it out and we cut it and it looks like this. It looks a bit bloody, but it will heal. So you can see here all the black color here, these are all laser burn marks. Okay. So this is a real life picture which looks at the stent here once we put it in. So this is one of the patients that we've done here. So this is what it looks like in real life when we go in. So this is in your airway. So your airway is about, the diameter is only about 4 centimeters. So we're working from a channel which is about a diameter of 4 centimeters. So it's not much space to work with, but it's doable. So this is the cancer here, we see it here, it's blocking the airway. So here you can see we're releasing the stent and it opens it up. So once you open up, all those mucus, all those phlegm, whatever starts to get released. right? So that's what it looks like inside. So it stays, now the stent stays in your body forever. It's made out of titanium, so it won't rot. Even after you die, it stays in your body. Now just to show you, so we can do all these procedures. So now just want to show you how we actually get the stent in. So we do what we call a rigid bronchoscopy. So you can see here, this is actually a video, the one that we did in Queen Elizabeth, but we do it here in Gleneagles as well. So what you have here is a metal rod here, which has a camera in the inside. So we push it into your mouth, go to the back of your throat here. Okay, so this metal rod, the diameter is about 4.5 cm, just about the size of your airway. So you can see that's the back of your throat there. All right, so we go in. So there's a camera there we show there. There you can see that's your voice box. That's where all our voice comes from. So this metal rod, then we just put it in, twist it a little bit around, get it into space. All right, so it's all in. So once it's all in, then we connect it to the machine to help you breathe. You'll be under general anesthesia, so you won't feel anything. So once the metal is in, then from that small 4 centimeter diameter, we can do all this microsurgery inside that I've shown you before. All right? Okay. So just very, very quickly, we're just coming to the end of it now. So this is what lung cancer screening is all about. It's been around since 2017. We've now got data even from the Dutch study. We've followed up the patient for 5 years, which shows the benefit goes beyond 20% reduction in death. So basically, just a few things about the data they've done is, so you can see here the sensitivity. With lung cancer screening, we can detect up to 93% of lung cancer. But specificity is 73, meaning that once we biopsy, sometimes it may not turn out to be cancer. So it's about 73%, which is still not too bad. So you can see here, compared to chest X-ray as low dose in terms of picking up the lung cancer is very low. So low dose CT goes up much higher, can pick it up much higher. Death for lung cancer, you can see there's a big difference if we pick it up by chest X-ray compared to low dose. So just to put it in perspective, if we do lung cancer screening, how much that it takes to save one life. So we all know that we do a lot of breast cancer screening, mammogram and everything. So you have to do close to about 2,000 patients to save one breast cancer patient. About 1,500 men to save them from prostate cancer. But for lung cancer, you only need to screen 200 patients, roughly around 200 patients, to save one life. So in terms of saving lives and cost effectiveness, lung cancer screening is the best. Right? And I'll just show you a few CT scans of the cases that we see here. And we're going to show you, what I'm going to show you is that why do these people present with very little symptoms? And the reason is because of this. When they have lung cancer, they tend to spread into the inner side of the lung, which means that you're not going to have any symptoms. So you can see here, this is the lung cancer. And as you can see, it's spreading inside. This is another one. So I didn't show you where the growth is, but I just want to show you where the spread has gone. So the spread has gone right here in the middle here. So when it goes into here, you're not going to feel anything. The moment it goes into here, automatically this is stage 3. So you can see here, this is somebody who presents quite late. This is stage 4. So the growth is actually this one. It's already, oh, sorry, this is the growth. What happens here is there's a spread here, and then there's water here. So this patient definitely has symptoms. This is another patient who did not have any symptoms, but picked up on, incidentally, on CT scan. And you can see it's already spread to here. This is bigger, much bigger than the previous CT films. So again, this is stage 3 already. Again, just to show you another picture, stage 3. Here again, the spread is to here and here. Alright, I think this is my few last slides already. So the final point is that lung cancer screening do save lives. 20% less lung cancer death each year if we do it. And the most important thing is timing is everything. So as we can see that if we catch it early, we can do surgery, we can achieve cure. But if we catch it late, then mortality is very high, prognosis is not very good. We do have a Gleneagles lung cancer screening package, which involves a CT scan as well. I think Vivian will tell you more about that one. But that's the end of my talk and the end of my slides. Thank you very much for listening.
Thank you, Dr. Arfian, for the sharing. Now, before we have received a few questions from the viewers, but before we proceed to the Q&A session, we will take a short break. Welcome back, everyone. Now, we have received a few questions from our viewers. So, Doctor, the first question is, how long can I live with lung cancer without knowing?
Without knowing.
Yeah.
That's quite difficult answer. Basically, what we can tell you is how long you can live if you already been diagnosed with lung cancer. Without knowing them, we don't know. But the majority of patients, once you're diagnosed with lung cancer, without treatment, we're looking at about 6 months to a year.
Okay. Next question, doctor. What are the possible signs of lung cancer?
Yeah, I think I've shown that in my slides. So majority of them will be respiratory symptoms. So basically coughing, coughing up blood, breathlessness and all that. But like I said, all the symptoms, you only get it when you lose 50% of your lung. So by the time you do develop symptoms, it's mostly late stage already. Yeah. So that is why it's recommended to do a lung cancer screening.
Okay, next question, doctor. Are people with lung cancer more likely to get COVID-19?
Yes. Now, how much of it we don't know yet because we don't have the data. But it's postulated that you are more likely to develop just as much as anyone with any chronic lung problem.
Okay. Next question, doctor. How common is lung cancer in women?
In women, I think I've shown the graph there, which is the Malaysian data. So in women, it's not too bad. It's about 4 to 8% in Malaysia. But then we have to see that a lot of women who do present with lung cancers are non-smokers. We're not really sure why, but we do have data to show that all these women who are non-smokers who develop lung cancer, they do test positive for certain gene mutation. So most likely it's a genetic predisposition. We're still studying it. But the good news is that once you have this gene mutation, there are new treatments that specifically target for this gene right now.
Okay, next question, doctor. Apart from cancer screening, is there any way we can do to detox, clean the lung?
No. I guess the only way you can detox is stop smoking, stay healthy. I mean, if we can, we choose a better place to live in with less air pollution and everything. I think the government made a good move to ban smoking in most of the public places, which reduces secondhand smoke exposure as well. So I think that's a very good move. So ideally, it's basically stay healthy.
Okay. Next question. Does quitting smoking reduce the risk of getting lung cancer?
Yes, it does actually. Now we've shown that my graph that shows the 10-year lag, but what the graph also shows that the more you smoke, the higher the incidence of lung cancer is. So the incidence of lung cancer is dependent on also how much you smoke. So it's always better if you do stop smoking. I didn't bring the slides up here, but for the body to fully recover from the effects of smoking, it takes up to 15 years.
Okay. Next question, doctor. Can lung cancer be cured permanently?
Yes, if we catch it early, stage 1 and stage 2. So that's why it's very important to do a lung cancer screening if you're in the high-risk group. If we catch it early, we can cure you properly. Yeah.
Okay. Next question. Okay. Will the testing and treatment be covered by insurance?
I don't think I'm the right person to ask for that. I think the right person to ask will be the insurance company. They are the policy makers. They are the one who decides on this. But as a clinician, my advice is if you're in the high risk group, go for lung cancer screening.
Okay, and that was the last question for today, doctor. Now, before we end, do you have any advice for our viewers today?
I guess basically just keep healthy. We're still in the pandemic of COVID. So everyone is still on their watchfulness and everything. But that doesn't mean you should delay treatment. During this time, I think in the last 1 or 2 months, I've suddenly had a big surge of patients who's come in, who's actually been coughing since February, but because of the MCO, they've delayed seeking consultation, and they all found out to have stage 4 lung cancers. So if possible, if you're sick, you're not well, you should seek treatment and not delay it.
Okay. Thank you so much, Dr. Arfian, for the updates. I believe our viewers out there receive a lot of useful information from this session. To all our viewers out there, we will be having a special promotion exclusively for AIA Berhad agent who join and register for this talk. We are offering this lung cancer screening package at 90 ringgit only. This promotion will start on 15 August until 30th September. This package is inclusive of chest x-ray, risk profiling, consultation and review with Dr. Arfian, and also additional on low-dose CT scan. If you are interested, please contact me or WhatsApp me at 016-78-475 for appointments. We are more than happy to assist you. We have come to the end of our live today. Thank you everyone for watching, and see you next time.